Good evening. Thanks for tuning in to Finding Hope, Idaho's mental health challenge presented by Opta. I'm Karen Lair. The combined newsroom resources of KIVI in Boise, KXLY in Spokane, and KIFI in Idaho Falls have been working for over a year on prioritizing coverage of mental health issues in Idaho. From personal stories and messages of inspiration to legislation changes and available treatment options. So why are we doing this? More and more resources are now being dedicated to responding to mental health calls in Idaho, and an alarming number of Idahoans are dying by suicide. According to the CDC, suicide rates in Idaho are the 5th highest in the country, and this is not just an adult problem. In fact, suicide is the 2nd leading cause of death for Idahoans 15 to 34 years old. The latest statistics are staggering. Among Idaho high school students surveyed in 2019, 39% say they've struggled with feelings of hopelessness or depression. More than 21% have seriously considered suicide. Nearly 10% have attempted suicide. Clinical psychologist Dr. Gretchen Goodmanson says it is critical for parents to have an open dialogue with their teens and pay attention to red flags.
It's very common for teens who are thinking about it to say as much. So they might say to their parent, "Oh, I wish I were dead," or I feel like I can't do this anymore. They may make such comments to their friends, to their teachers, to their coaches. Asking is important. Asking very directly and clearly if a child or adolescent is thinking about suicide is helpful. It doesn't cause suicide, and in fact, if anything, it reduces risk.
The National Alliance on Mental Health encourages parents to keep an eye out for these warning signs. Feeling sad or withdrawn for more than 2 weeks, drastic changes in behavior, personality, or sleeping habits, withholding from meals, or sudden overwhelming fear for no reason, sometimes with a racing heartbeat, physical discomfort, or fast breathing. One state-led initiative working to lower teen suicide rates is a focus on social-emotional learning in Idaho schools. The idea is to make sure teachers are equipped to handle the mental health of their students. The move came ahead of State Superintendent Sherry Ibarra's request for $1 million to fund training for trauma-informed teaching.
We want all of our educators and anybody who touches the life of a child to have all the resources and training available so we can stop incidences before they happen.
The governor's education task force has also made social emotional learning one of its top recommendations, announcing earlier this month in his State of the State address plans to provide funding for additional training to better serve Idaho students facing trauma and mental illness. One program already in more than 100 Idaho schools aims to improve students' mental health, including at Meridian's Mountain View High School. 6 on Your Side's Michelle Edmonds was asked to go through that training and brings us an inside look at sources of strength.
It didn't look like a normal day for some students and teachers at Mountain View. This group is on a mission to change the culture at one of the largest high schools in the state.
I was really interested in it because I was excited to see that a school is actually taking steps, like actively taking steps to try and improve the community that they had and build a culture that was more around supporting people rather than tearing them down.
Teachers nominated students to be peer facilitators for a program called Sources of Strength. In between games and laughter, this all-day training session got very real. The teens opened up about heavy issues they face, like depression, family and peer pressure, even suicide.
A lot of people don't feel like it's okay to talk about not being okay, or to talk about not being able to handle it all.
Sources of Strength starts with fostering strong relationships between students and trusted adults at school. From there, it's the kids who spread the message of inclusion and safety to their peers.
Having a place where students can actually reach out to other students is important because it's intimidating talking to an adult. It's really scary.
Mountain View is in its 2nd year of the program, and counselors realize it will take time to reach a generation that primarily communicates by phone and can never escape social media.
Looking back on the first year, it was hard. It's hard to implement a program this big and change. It's really a culture shift, more or less of trying to focus on positives rather than focusing on statistics and the negative.
One parent volunteer says investing in sources of strength works. Jen Betcher experienced the program's positive influence at her children's former school in Wisconsin. So when her family moved to the Treasure Valley last year, Jen's top criteria in choosing a school was making sure it had sources of strength.
A school that invests in sources of strength is really committed to the overall mental health and well-being of their student body, and that was so important to me.
Michelle Edmonds, 6 on your side.
Well, experts say one major player in the deteriorating mental health of Idaho teens is the constant use of social media. Consistently competing for the most likes or followers is leading teens to compare themselves to their peers, becoming one of the leading causes of anxiety and depression. Experts say teen girls are especially prone to these problems, becoming obsessed with image-based apps like Snapchat and Instagram. But that's where parents can step in to protect their children.
It's called RPACT, and they can block whatever app. So if they see that I'm getting anxious or tired, that app's gone. Like, they will block it from my phone for a while.
Experts also suggest declaring social media-free zones in the home where the entire family stays off their smartphones. Plus, staying off your device for at least an hour before bed can help improve sleep and mental health. Still ahead on our Finding Hope special presented by Optum.
It was just really hard to hear that all of a sudden I have this bipolar disorder and that I'm not who I was, and maybe I wouldn't be there again.
We hear personal stories from Idahoans taking their mental health into their own hands.
Get help as soon as you need it, and as soon as you recognize that you're not feeling right or something is wrong.
Reaching mental stability starts first with asking for help. It's no secret finding affordable, quality health care in rural Idaho is challenging. That's why one community is celebrating the success of its tribally owned health center. Ariana Lake with 4 News Now takes us to Plummer to see how they're changing lives.
Charlotte Nielsen was walking through life in the shadow of grief.
When I was first diagnosed with depression, I denied it.
At first, Charlotte felt labeled by having to see a behavioral health specialist.
There's a stigma about it, so you don't even want to address the fact of behavioral issues.
So many others face this same challenge. Research suggests that Native people are disproportionately burdened by mental health problems and other health issues. Here in Plummer, there's a place to get support.
With the help of Mariman Health, I was able to understand and become more aware of the issues that a person suffers from.
The Coeur d'Alene tribe opened Mariman Health Center decades ago. It's expanded over the years, but one thing has remained the same: a commitment to healing the mind, body, and spirit.
We feel it's really important to treat the whole person, so we have services all under one roof.
That includes dental, medical, optometry, behavioral health, and outreach programs. Everyone is welcome here, and no one is turned away if they can't pay.
We have a lot of pride in just knowing that other tribes, other health facilities, other community health centers are looking to us to really pave the way in integrated care.
Providers also balance innovative techniques with tribal traditions.
They are so open to a lot of our traditions and cultures, and they continue to listen and provide direction.
That helped give Charlotte the tools to take her next steps.
Get help as soon as you need it, and as soon as you recognize that you're not feeling right or something is wrong, because there are so many options up here.
And even more programs are coming to Plummer.
As you can see, this center is definitely having an impact on people's lives here. Leaders here tell me they're already looking at plans to expand. Reporting in North Idaho, I'm Ariana Lake.
When it comes to battling the stigma of a mental health diagnosis, one Boise mom says conversation is key. That's why she opened up about her own journey with bipolar disorder in an effort to show others how she is finding hope. Kylie Wiscombe describes herself as a happy-go-lucky person, but shortly after the birth of her second son, her mood changed. The highs and lows only got worse over the next year, leaving Kylie and her husband desperate for an answer.
He was looking for solutions, so he starts Googling, what is this? And so he comes to me at one point and he said, maybe you have bipolar disorder, right? And I was like, oh, What? That is so rude.
Yet suicidal thoughts scared the Boise mom enough to see a psychiatrist. A bipolar diagnosis followed, hitting her with a wave of shame. Ultimately, a stint of hallucinations sent the Treasure Valley mom to a court-ordered stay at a mental health hospital.
And if bipolar diagnosis was shame before, mental health facility, like that's revving up the shame right there. Like how did this happen? How did I possibly end up in a psychiatric hospital?
Kylie was released 2 days later and praises her husband for being her rock. From there, she created Greater, a nonprofit with the goal of helping to end the stigma surrounding mental health by sharing resources and authentic stories. Experts say 12 to 15% of mothers experience some form of postpartum depression after the birth of their child. Mom of two, Marielle Kessler, was one of them. She tells us she experienced postpartum depression and anxiety after the birth of both her children. Sleep deprivation and trouble breastfeeding had a big impact on her emotions, along with a major hormonal adjustment.
Your hormones really are kind of taking over, and so you're not yourself, but you can get through it. It feels so debilitating. It feels like you can't really get out of that dark place when you're in it.
Kessler's perinatal mental health counselor at St. Alphonsus uses cognitive behavioral therapy to help new parents adjust and says parents should always remember the basics. Drink water, eat healthy meals with protein consistently, take a walk outside when you can, and most importantly, sleep. So what are the signs of postpartum depression to look for? Feelings of hopelessness and worthlessness, significant crying, feeling sad and miserable, overwhelmed and worried, and having scary, intrusive thoughts. Well, St. Alphonsus has many support groups available, and midwives at St. Luke's and Meridian are helping their patients recognize those signs early on. 6 on Your Side's Jillian Garrigues reports.
Adjusting to life with a new baby can be difficult.
It's a huge life change.
Lack of sleep, extra stress, and add in changing hormones, and postpartum depression can impact many mothers.
Your placenta makes as many hormones in one day as a non-pregnant woman makes in a whole year. So you're exposed to that for 9-10 months, and then we take it away and your hormones drop significantly.
At St. Luke's Meridian Medical Center, Katie Oboski is a certified nurse midwife. She screens her patients with the Edinburgh Postnatal Depression Scale after they've had a baby. It's a simple survey asking parents 10 questions related to how they're currently feeling mentally.
Are you finding enjoyment from things that you used to find enjoyment from? Do you unnecessarily blame yourself when things go wrong? Do you feel guilty for no reason? Are you overly anxious?
Answers can range from no, not at all, to yes most of the time, and lead midwives to a deeper conversation with their patients on mental health.
I think a big one is like where you can't even sleep even though you're exhausted, because maybe you're only getting 1 or 2 hours of sleep at a time with a newborn, but you can't sleep because you're so worried about your baby not sleeping or not waking up. Another red flag, I think, is if you just have total disinterest in yourself, your baby, your other children, your family.
Patients complete the Edinburgh scale at their 1-week postpartum checkup and again at 6 weeks. It's an effort to catch signs of depression or anxiety early and get new parents the treatment they need.
Sometimes it's talking about your birth experience, writing about it, talking about it not only with us, but maybe with a counselor. Sometimes we talk about medications like antidepressants. Not only do they help with your mood, but they do help with anxiety too, and they are safe when you're breastfeeding.
And most importantly is self-care. Oboski tells new moms to get sleep, eat healthy, and don't feel guilty taking time for yourself.
Remember that you can't fill up other people's cups from an empty pitcher.
Jillian Garrigues, 6 on Your Side.
Well, one thing we've learned through our Finding Hope coverage is that for those experiencing a mental health crisis, asking for help is often the hardest part. 28-year-old Caldwell woman Hillary Miller is proud to be in control of her mental health after spending a majority of her life looking for stability. She's diagnosed with bipolar disorder, PTSD, borderline personality disorder, and anxiety. She says she's survived countless suicide attempts, and after years of therapy, she's now encouraging others to reach out for help when they need it.
It's okay to ask for help, and asking for help doesn't mean you're weak. It doesn't mean that it's a bad thing. It just means that in your time of need, there are people out there to help you, and you don't have to suffer alone.
If you or anyone you know is experiencing suicidal thoughts, you can always reach out to the Idaho Suicide Prevention Hotline. You don't have to be actively suicidal to call, and it can even be a good resource if you're concerned about a loved one. The phone number is on your screen, and we have more resources for you on our website, 6onyourside.com, under the Finding Hope tab. Still ahead on our Finding Hope special.
These officers, these firefighters, they're spending 29, 30 years seeing very, very horrific things.
We take a look at how the mental health of Idaho's first responders is now becoming a top priority at agencies across the state.
How do things work? Things that give so much joy and happiness. How does everything that is so beautiful happen without us really understanding how it happens? How do we help people lead their healthiest lives? How can shared intelligence spark brilliant solutions? How can doctors and patients build even stronger relationships? How can we improve the quality of healthcare and make it more affordable? How can we help manage chronic illness? How can we help people keep an eye on their health 24/7? How do we bring everyone together so that healthcare finally works for all of us? We know how. We are the how. Optum. How well gets done.
We fix things, we don't need fixed. Like, we go out and take care of everybody, we're not the ones that need to be taken care of.
Breaking down stigmas surrounding the mental health of Idaho's first responders. Idaho's police, paramedics, and firefighters are the first to see and hear some of the most gruesome details of deadly crimes, crashes, overdoses, and acts of God in the state. And as we've learned through our Finding Hope series, they are not immune to mental illness and often need treatment for psychological injuries incurred while on the job. The suicide death of a Boise firefighter last spring helped shine a light on mental health needs for first responders in the state. Early Tuesday morning, May 21st, firefighters at Station 6 discovered senior firefighter Charlie Ruffing died by suicide while working overnight, leading first responders across the valley to band together, opening up about their own struggles with depression and post-traumatic stress.
New firefighters saw veteran firefighters break down, and they talked about their feelings and how they were feeling that day, and really that has changed the stigma around it. Other firefighters are seeing that it's okay to seek treatment, that it's okay to not be okay.
That's where Lisa Johnson steps in, working closely with first responders for 20 years and now the go-to counselor for many departments across the Treasure Valley seeking help with what are called post-traumatic stress injuries.
They don't just go to one traumatic call, they go to thousands of traumatic calls, things we can't even imagine. And it's like having a backpack and you're throwing a pebble into that backpack, and all of a sudden that backpack is really heavy with lots of, traumatic incidents that they see, experience, and witness.
Both Johnson and Chief Doan emphasize PTSI is a treatable condition, especially if caught quickly. So in an effort to help firefighters get into counseling early on, the department is implementing a new step for their new recruits, involving their families in the process.
We're going to have a spousal academy afterwards too. So when we hire new firefighters, that their spouses and their significant others are going to come to some training so they can recognize things that are happening at home.
Look for warning signs.
Yeah, looking for warning signs.
Boise Fire has also been utilizing their peer support group, ensuring everyone in the department has an outlet to open up in a way they'll feel most comfortable. That's composed of roughly 20 firefighters and police officers who know firsthand the kinds of situations they're dealing with, allowing them to connect and open up to someone who truly understands what they're going through. Well, it's no secret more and more calls to police are in response to mental health breakdowns, but have you ever stopped to consider how the person responding to your 911 call could also be in crisis? Ada County paramedic Cameo Akins opened up to 6 on Your Side, sharing her experience with suicidal thoughts one March night when her firefighter husband was out of town. She came close to attempting suicide and called her husband, who called 911 on her behalf. The support she received from there made all the difference.
My supervisors were able to show up, and an officer showed up, and really were able to kind of walk me through the process. I was really scared. I was embarrassed. You could see the aftermath of what happened with, your friends and family and how scared they were.
Well, she sought treatment, ultimately returned to work, and is using her experiences to help others. She started a nonprofit called Silence Isn't Silent to help fund mental health treatment for first responders. After years of efforts by some local law enforcement leaders, Governor Brad Little signed a bill into law during the 2019 session, giving Idaho's first responders coverage for treatment of psychological injuries sustained on the job. They will now be able to file workers' compensation claims for injuries from post-traumatic stress. Governor Little says it's the right thing to do for our first responders and their families. Advocates said it will help keep police, firefighters, and EMTs on the job long term, limiting turnover while reducing the risk of suicide. Well, on top of that, a nonprofit hotline for first responders by first responders is available to those on the front lines in the Northwest. The Code 4 Northwest Crisis Line started after longtime Seattle police officer Steve Redmond noticed stigmas were preventing first responders from seeking treatment. Idahoans are eligible and encouraged to make a call.
Then there's the culture of sign of weakness. You ask for help, that's weak, because just pull your big boy britches up and move on. And that was been the culture, and that's the culture that we're trying to change.
Plus, the ones answering the phones at Code 4 are all first responders themselves. Still ahead on our Finding Hope special.
I've had several suicide attempts. I even had one when I was in the military in Saudi Arabia.
We take a look at what mental health resources are available for civilians and veterans in the state of Idaho.
Prominence that this 3-digit number will bring to suicide prevention is extraordinary.
New steps improving access to resource for Americans dealing with a mental health crisis. According to the VA, 10% of Idaho's adult population was made up of veterans in 2017, yet in that same year, veterans accounted for 20% of the state's 400 suicides. Several organizations around Idaho are helping to shine a light on mental health needs for vets by organizing concerts, motorcycle rides, and fitness challenges, and the VA in Boise is also offering a bounty of resources. Mountain Home veteran Crystal Duncan took advantage of those options after attempting suicide herself several times. She says she was discharged from the Air Force after 16 years and found herself hospitalized, then homeless. After falling victim to addiction, she forced herself into the Boise VA, where she got connected with a psychiatrist, therapist, and group meetings.
Well, it's just like using the military. We've got 5 branches, but we couldn't get the job done if it wasn't for all 5 of these branches, you know?
Now she spends her time volunteering with the Boise Police Department and veteran peer support groups. A real success story coming out of Pocatello is having a big impact on the community. Local News 8's Emma Iannacone took a closer look at how the Southeast Idaho Behavioral Crisis Center is changing lives.
They just find that there's a place that they can go to that is safe. It's been a great benefit to our community.
The center's second quarterly report is in, and it's showing huge success. In fact, every patient that took an exit survey said they would refer someone to the center or even come back if they needed to.
So to get that feedback
means that my staff is doing their job. We're addressing the issues that we need to that are coming in.
One big payoff, the impacts on law enforcement.
One of the key things is it takes about 10 minutes for them to drop them off at the crisis center.
Which potentially saved law enforcement 4 to 6 hours every time they would have dropped a person off at the emergency room.
So just the time savings for law enforcement to drop them off has been a big plus.
The main reason people are using the facility is for detox and mental health. But without the center, 36% of clients would have gone to the hospital and 21% would have gone to jail.
If somebody goes to jail for substance use, they have to sober up, they have to get processed, they have to go through all of those things before they can get out and then hopefully get assigned to treatment. If they can come here, that time frame from the actual use or crisis to treatment is just a lot shorter.
Looking ahead, there are some big obstacles for the crisis center. Once Medicaid expansion goes into effect at the start of the new year, large chunks of the Millennium Fund will be moved away from crisis centers to pay for the expansion.
Being a brand new facility, that's a little scary to us, but on the other hand, we're going to be able to bill Medicaid for individuals who qualify for Medicaid. So hopefully we can make up that difference.
In the long term, the center's board hopes to make the resource more accessible to surrounding counties. Bannock County is the primary user of the facility.
We want to continue to be that service to the community that wasn't served before, and just continue to improve on that.
In Pocatello, I'm Emma Iannacone.
Well, for those in the Treasure Valley, a new crisis center opened its doors in Canyon County last spring, keeping those in need of immediate mental health services out of jail and in touch with helpful resources.
Maybe they have a mental health crisis or a substance use crisis, and they're not actively suicidal, but maybe they have suicidal thoughts or they're in crisis.
Citizens that experience these problems often were incarcerated, hospitalized, treated in emergency departments.
This, the governor says, is costly to taxpayers. So the first of its kind facility in Canyon County is giving what many are calling a glimmer of hope for adults in those gray area situations. Well, of course, you don't have to live near either of those crisis centers to receive help. Volunteers at the Idaho Suicide Prevention Hotline are taking calls 24/7 for anyone who's actively suicidal or just needs someone to talk to. Staff has also recently increased their outbound follow-up calls to Idahoans who are released from emergency departments or crisis centers after a suicide attempt.
What we found and what the research is finding is that people that receive this discharge follow-up contact from a crisis center, they do better. They have fewer suicide attempts post-discharge. They have lower readmission rates, so people aren't coming back to the ER within a few more days or weeks, and they're making their appointments.
The Suicide Prevention Hotline is also always looking for more volunteers to improve their service to the community. If you're interested, you can head to idahosuicideprevention.org. Well, just last month, the FCC unanimously voted to move forward with a proposal to create a nationwide mental health hotline that would be as easy to call as 911. For decades, the Suicide Prevention Hotline has been a 10-digit 800 number, but soon, Idahoans in crisis could get mental health by just dialing 988. Mental health experts say shortening the number makes it easier to remember and could save lives in the process. Beyond the number change, experts say there needs to be funding for local call centers around the country to take on any of these added calls, only furthering the need for more volunteers here in Idaho. We've covered a lot in the last half hour. How parents can watch for warning signs that could signal mental health concerns in your children. We've seen how state-led initiatives are trying to open up the conversation around mental health in Idaho classrooms and how they're already working. From North Idaho tribes to Moms in Meridian and even Idaho's first responders, resources are available across the state to help address concerns for civilians and veterans in Idaho. Well, we know you may have been a little too busy to jot down some of the phone numbers we've shared with you throughout this show, so we've put them all in one easy place for you to find in your own time. Everything we've shared with you today is on our website. To rewatch these stories in their entirety or to help find some resources and phone numbers, you can always head to 6onyourside.com and click on the Finding Hope tab. Thank you for joining Finding Hope, Idaho's Mental Health Challenge, presented by Optum. And remember, it's okay to not be okay. There are people out there waiting to help. You just have to take that first step and ask for it.